I'm Murray Feldstein, visiting fellow for healthcare policy at the Goldwater Institute. The true story in this webpage is about Alice Smith, one of the many heroes of the pandemic, a nurse practitioner whose patients live in the area with the highest coronavirus death rate in the state of Arizona. She's been a professional colleague of mine for over 40 years, but she refuses to let me use her real name. She's too modest, and right now too busy to put up with any unwanted attention. She says she is doing nothing more than what she's been trained to do, nothing more than what thousands of other nurse practitioners are doing around the country today. Arizona is one of the more enlightened states when it comes to letting nurse practitioners work at the top of their license, meaning they are legally permitted to practice what they have been trained, tested, and certified to do. There are 20 other states besides Arizona that permit nurse practitioners to independently diagnose, treat, and comfort sick patients. But the other states require nurses to either work under direct supervision or have some kind of contract with a supervising medical doctor. Influential doctors' organizations in those more restrictive states have somehow convinced their state legislators that nurse practitioners are not competent enough to practice independently by themselves. But pandemics have a way of bringing out the truth. All but 11 of the 29 more restrictive states have temporarily suspended these regulations because they know it's better to meet a pandemic with all your hands on deck, not tied behind your back. The states that wisely cut their red tape should make these changes permanent after the crisis is over. We have a chronic shortage of qualified healthcare workers in this country in the best of times. Nurse practitioners can help make up that shortage. If doctors oppose other healthcare workers from standing alongside of them as part of a team of proud independent professionals, they should at least be made to present some evidence to back up their claims. There is ample evidence in numerous scientific reports, as well in the experience of states like Arizona, that this claim of incompetence is wrong. Alice Smith and thousands of other nurse practitioners just like her are living proof that they are wrong. Thank you for your continued interest in the Goldwater Institute's response to the coronavirus pandemic.